Once we have assessed a client and we find you have specific deficits in terms of development, now we develop a development treatment plan. So if it is a fine motor skills which you don't have, we will show you the activities we do, and it's on a repetition. The brain, there is a concept we call plasticity of the brain.
Plasticity?
Yes, plasticity of the brain. The brain has the ability to relearn and learn skills. So once maybe it's a concentration you don't have, we start from the level of the child. We start training concentration skill on a repetitive basis, and this repetition enables that child to learn and to improve. If it's a developmental milestone, for example, the child is not able to stand, is not able to sit, we start positioning, and we have specific treatment protocols on how to handle that. So on a case-to-case basis, occupational therapy now addresses this occupational performance deficits, if it's concentration, if it's coordination, if it's eye-hand coordination, if it's the gross motor skills, to enable this child develop as near normal as possible, or to eliminate as all. Not all conditions that this child would get to normal, but we make you to be as independent as possible so that you are able to function on your own or with minimal assistance. So some conditions you might not change the condition completely, but your intervention could improve the probability of this individual being able to be independent. Our model of intervention is based on the functional independence. If you are able to do things on your own, if it's a child is able to go to school, sit down, write, take instructions and do things, dress himself, we call it activities of daily living, feed yourself and all that, then that is, we are okay. So the intervention is geared towards the specific needs, but it is always geared to improve that functionality. Yes.
This concentration, can an adult relearn concentration?
Depending on what was the cause of the loss of that.
Kuna watu wengi hawezi concentrate.
Okay. What happens? We have what we call the functions of the brain. Once you lose some function, a brain is like in a football match. You have a super substitute, and you have the first line player. So if you lose number 9 player, you have a substitute who does that function. So the brain is categorized into two hemispheres. They have the right and left. So if you lose a function which maybe is controlling motor control or concentration or any skill, there is a part of the brain which is readily available to rerun those skills. So depending on the quality of the intervention, the time of intervention, and the cause of the deficit, the brain is able to rerun. That is what I meant by plasticity of the brain. Of course, it's optimal at the younger you are, but it is always functioning with time. Of course, this is for adults. So we call that shoulder width. It's adjustable depending on the, what does it do? Yeah. Depending on the strength of the client. Now like I mentioned, we have adults who need occupational therapy. Maybe they have a hand injury, the shoulder, or any other thing affecting the upper extremity, or they have a stroke. They cannot even move this hand like this. So there is a way you create the resistance, then you tell them back round. By doing that, is it difficult? It can be difficult depending on your deficit. You are not a patient now, it's very easy for you. But for a patient who do that and the movement and all that, it's that kind of that is required activity, and then with repetition find you're increasing the strength, muscle strength, the coordination.
Right position?
It's if you see it,
supposed to be seated.
So imagine a patient who cannot move, for example, this hand like this, having stiffness or what we call limitation in range of motion. Then you are giving them this, then take round. By the time we push down, you're on to full legs. You see now? Yes. And that it's also working on the grasp, the coordination, and the stability of that hand. So this is a shoulder width for that purpose.
How fast should one either visit the hospital or see an occupational therapist when they notice that something is amiss? Okay.
The model of referral of clients. There are those who will be referred by the primary physician or the doctor. Of course, we start intervening. For example, in our facility, we start intervening our patient even in ICU. We assess that level, then start our program there. There are those children, for example, it's what we call neonatal screening. The moment you identify that this is a child at high risk of developmental delay, you start monitoring there. And that monitoring and facilitation is a precursor for good prognosis. Good prognosis here, I mean, for better outcomes, for you to be able to achieve maximum, the area, the intervention. So the time of seeking intervention is also a determinant or an indicator of the progress and prognosis. Yes.
And why are you training footballers with a very big ball?
No, they are not footballers. This is a therapy ball, or we call it a Swiss ball. We use it for various functions. We have what we call vestibular stimulation. When you have no balance, you position the child here, and then you have the mirror, you try to stabilize. There is a reflex, you are doing that to strengthen that. Then we do it for trunk strengthening, which I can demonstrate on you. You lie on this?
I lie on it.
Yes. For example, no. For example, this. Then we do a lot of activities there.
Yes.
To strengthen that. Then you come up. So depending on the size, for example, this is not meant for you.
Yes.
Then you are training this child to crawl and all that.
Yes.
Positioning like that. They position that for strengthening of the upper extremity.
How do I start crawling when I'm like this?
Not using this.
So
First of all, for you to crawl, you must have that what we call pronon force. You must be able to be in this position
like that.
for you to be able to crawl.
Yes.
So you must start from there. So it's a weight bearing position for strengthening, and then you move now. In terms of these disabilities, it is not even the person suffering this condition who has a problem. It is not even the parents, but the society, the way we perceive, the prejudice we have, the ignorance, the stigma, and all that. Can I tell you, for example, 90% of my practice, I've come across single mothers bringing children for therapy. And while they are single, you find the husband disappeared when the child was diagnosed a condition. It becomes a norm or a myth that this is the cause of the problem. They get to disappear. They run away. Then also the society, when you see someone on a wheelchair, we look at this as a disability. So that kind of stigma and prejudice, it even discourages the person suffering from this or the caregiver. Also, in terms of society, there is, in this country, for example, there is a lot of segregation and prejudice. For example, most of our patients, even if you have a medical cover, this medical insurance also is a business. So they know this condition is a lifelong or is going to take more money. They'll say it's an exclusion. So that is a societal problem, because in the UK or in developed countries, when you have a child with disability, you are even paid to take care of that child. And because you are not able, for example, our session here, like I told you, you bring a child for 3-4 sessions per week. So which employer would allow you to be off for 3-4 sessions? You are sacked. That is a societal problem and a policy problem. Insurances, they have exclusion. In fact, you get a child with cerebral palsy or autism, they'll say we don't cover this, because they know probably you come for occupational therapy sessions for 2-3 sessions a week, that is maybe 7,000. They project that, they'll see there's no business sense in them, they'll say this is an exclusion. So that is a societal still problem. Yeah.
I feel like you are talking, or you want to talk to parents who have children, or even people in families who have such kind of patients. Yes. What is your advice to them?
What I can tell the parents and the caregivers and the society in general, if you have a child with a disability, no matter the kind of condition and no matter when did you discover the disability, there is always intervention, there is always help. Don't give up. just seek medical attention, you come for occupational therapy. There are other therapies, combined physiotherapy and speech therapy services, so that we intervene that service at that level, so that this individual is able to function as independent as possible at that level. Because if we keep them in the society or we hide them, still we are not doing any service to them and justice. Because even in this country we have what we call a Disability Act of 2003, which enumerates what are the requirements, what are the rights of these people with disabilities and all that. So bring them to a facility. These services are affordable and they are payable, and there's always help. We have experts around who are supposed to intervene. So you don't hide, don't shy away, come for the services.
As a caregiver, why would I choose the Karen Hospital Occupational Therapy Department?
Occupational therapy in Karen Hospital is one of its kind, because here we have a one-stop shop. First of all, we have an integrated kind of service delivery. In physical medicine, we have services of physiotherapy, occupational therapy, speech therapy, and orthopedic technology. So in Karen Hospital, these services are available at one-stop shop compared to other facilities. Then look at the equipment around we have. The facility you cannot match with others. Then the cost of our services is relatively cheaper and affordable compared to other facilities. And lastly, we have one of the best qualified therapists, and the environment is child-friendly. So this is the place to be.
Is that therapist Mark?
This is the Mark and team. we have other team members.
Okay.
Yeah, so this is the service you can get here.
When are you available?
Occupational therapy services and speech therapy and physiotherapy services are available in 24 hours. These are 24-hour economy, and these are 24-hour hospital. Anytime you walk in, you'll get a therapist to help you. You can reach through the hospital, and even our satellite branches, we have these services setting up. Of course, not all of them, but we are available every day of the week. Anytime you make an appointment or you walk in, you get a therapist to help you. Yes.
So you're telling us that you are on standby to help the patients who require occupational therapy.
Yes. You can reach us anytime. And even if you find maybe there is a session going on, we can book you or we can give you a slot when you can be seen.
There you have it. That is occupational therapy, and I'm sure you've learned a lot, just as I have, from our occupational therapist, Mark Nyachieo, right here at the Karen Hospital. Now, if you have a child, or you need somebody you know somebody who needs these services, the occupational therapy and all that, please, you know where to go, right here, or you know where to come, right here at the Karen Hospital. In the meantime, keep subscribing for more content.
Have you subscribed?
Ba 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 ba.